Good morning, everyone. My name is Greg Levine, and welcome to the 2021 Vitality Health Roadshow. It's a roadshow with a difference, given the backdrop and challenging times that we are living through today. Rather than a face-to-face and stage presentation, we'll be inviting you all into our homes, where we'll be sharing with you insights, updates, and predictions from some of the key leaders within the Vitality Health business. So kicking off today is someone you all know very well, the Vitality Group CEO, Neville Kupovitz. Good morning, Neville, and thank you for joining us today.
Thank you, Greg. Good morning and welcome to the Vitality Health Business Update. The last 12 months have been extremely challenging for all of us, but due to your support, we as an organization, I believe, have emerged stronger. What I'd like to do today is share some of my thoughts with you on post-COVID-19 and how we as an organization are well positioned for the future. I'd like to start off by touching on some global trends that have been accelerated by the pandemic. Firstly, we've seen significant evidence that people leading unhealthy lifestyles are also more at risk of serious complications when contracting COVID-19. This is leading to an increased focus on health and healthy aging. Secondly, the pandemic has generated renewed awareness of the need for protection, and I believe this will lead to an increased demand for both health and life insurance in the future. We are already seeing the effects of this in our retention experience, as members choose to hold on to their cover despite the difficult economic environment. Adoption of digital technologies has increased dramatically, and this has seen a rise in the use of digital healthcare on online fitness solutions, virtual GP consults, and home workout apps, together with increasingly flexible remote working. While this adoption was driven by COVID, I believe many of these changes will remain post-COVID. And finally, over the past year, we have seen the increased prominence of social responsibility. Society is expecting much more of companies, and it is no longer acceptable for a company to simply deliver good financial performance. They also have to demonstrate that they are making a positive contribution to society. And I personally believe the businesses that will be truly successful in the future are those capable of addressing societal needs and challenges in a profitable way directly through their business model. Against this backdrop, I'd like to remind you that Vitality is a purpose-driven organization with a powerful reason for existence. Our core purpose of making people healthier and enhancing and protecting their lives is what drives us as an organization. And we firmly believe it will become more relevant than ever before in a post-COVID world. We deliver on this core purpose through what we call our shared value insurance model. What I'd like to share with you today by way of video is a demonstration of how the model works conceptually and explaining the powerful assets that underpin it.
At Vitality, our core purpose is to make people healthier and to enhance and protect their lives. This led us to create the Vitality Program, based on the simple insight that when we make our members healthier, it's good for them, good for us as an insurer, and good for society. Through the Vitality Program, we incentivize members to make positive health choices. They benefit from better health and tangible financial benefits, such as lower premiums on their insurance and valuable rewards. For us, as an insurer, healthier members have fewer claims, and by being engaged, they stay with us for longer. Some of the surplus generated can be shared with members in the form of further incentives, fueling a self-reinforcing cycle of health improvement and value creation. In the process, broader societal groups such as employers and public healthcare systems benefit from the improved health and productivity of the population. This is shared value insurance.
The shared value model is underpinned by our unique Vitality program. The Vitality program is fundamentally different from other wellness programs, loyalty programs, or reward programs. Let me tell you why. From a member's perspective, it is really intuitive with our member app as the key interface. Members engage with their health, they earn rewards, and they get to lead a healthier lifestyle. However, while intuitive to the member, below the surface, the Vitality program is underpinned by a sophisticated ecosystem of assets that incentivize behavior change. It centers on those modifiable behaviors which drive insurance risk, such as physical activity, nutrition, and other lifestyle choices. The Vitality member app, the member zone, and other personalized nudges serve as the interface between the member behaviors and expertly designed benefits and incentive mechanisms, which leverage clinical expertise and behavioral psychology to modify behavior. These include clinical and behavioral IP, such as the Vitality Age algorithm and Vitality points and statuses, incentive mechanisms such as weekly and monthly active rewards, status-based rewards, and integrated insurance benefits, such as VitalityHealth's ABC renewal pricing and Vitality Life's optimizers, and access benefits which lower the barriers for entry for improving one's health, such as discounted devices, gym memberships, and trainers, to name a few. These benefits and incentives are delivered by our network of aspirational partners through some sophisticated technology integrations. And finally, this is underpinned by our machine learning and analytics capabilities and data assets, which enable increasingly personalized interactions with our members. In combination, these assets are effective at modifying behaviors that drive insurance risk for the benefit of our members, ourselves, and society. When we integrate this program with our best-of-breed insurance products, this approach allows us to unlock powerful competitive advantages in highly competitive markets, simply by incentivizing members to change their behavior. And this approach manifests consistently across our life, health, and invest businesses. And soon, this will also manifest across our new Vitality car business as well. The model is working well in the UK. The evidence shows that you can see the broad appeal of the model demonstrated here through the 1.4 million members that have joined Vitality in the UK. Next, the exceptional engagement it drives amongst our members is demonstrated here through the 52 million physical activity events completed last year. Then the tremendous value we have shared with our members through benefits and rewards, which exceeded £100 million in 2019. And finally, we see the impact of the model come through in our retention efforts, in mortality and morbidity, and this positive impact increasing as a member engages more with the program. The model has been adopted by leading insurers globally who have partnered with Vitality. Today, it is prevalent in 27 markets across 6 continents, covering more than 20 million lives. And I think one of the biggest accolades was given last year when Accenture announced that Discovery Vitality were recognized as a global innovator for pioneering a new category of financial services. And I would like to use this opportunity to thank you all for your support, especially during this past 12 months. Our business has proven to be extremely resilient, and that is only possible through the ongoing support that we have received from our partners like yourselves out there. Thank you very much for your time, and I now would like to hand back to Greg.
Thank you, Neville, for providing a comprehensive overview of the Vitality business in the UK, but also the ecosystem of assets that truly drive behavior change and make Vitality a world leader in this area. So today's presentation will be divided into 4 key sections. Firstly, we will deep dive into our healthcare world with insights around COVID, the digitization of healthcare, mental well-being, and our new Menopause initiative. The next section will be all about how we've driven well-being and supported our members, your customers, through this lockdown period. Section 3 continues the theme we've always spoken about of making Vitality easy to do business with. And we'll share some key trends, insights, observations, and also some really exciting new technological innovations. And finally, we'll talk about expanding the Vitality program through our exciting uninsured proposition. So let's now move to our first section, covering our health offering. And leading this is our Managing Director of VitalityHealth, Keith Clintworth.
Hello. The health business continues to focus on 3 key themes: the market-leading product and proposition, the leading-edge digital experience, and simple and intuitive member journeys. As we prepare to ease out of this lockdown, we need to maintain some realism that this is far from over. I do believe we will evolve from a pandemic to COVID-2 becoming more endemic, needing regular vaccinations to protect the at-risk. Developing herd immunity is an imperative, and the key rationale is to protect the vulnerable population that cannot, for medical reasons, have the vaccine. A vaccine that is 90% effective at blocking transmission will need to reach at least 55% of the population to achieve temporary herd immunity, as long as some social distancing measures, such as face masks and many people working from home, remains in place. We do need to improve our track and trace and/or quarantine procedures for incoming travellers. The experience of 2020 has accelerated a trend towards remote and digitally enabled healthcare, as well as a renewed focus on healthy living, enabled by digital technology, home workouts, and wearable devices. Vitality has been at the forefront of these trends, and we'll be announcing further developments in our launch later this year. We continue to improve our members' claim journeys and experiences, and have utilized the COVID experience to drive far more proactive calls to assist our members accessing the care they needed, and to manage their expectations as when certain conditions and treatments would be more widely available. Over the last 2 weeks, claim authorization levels are greater than comparative years, which is a positive sign that provider access, firstly, has started to improve, and more importantly, members' willingness to access treatments has returned to the new normal. The post-pandemic impact to claims costs is still uncertain, and we remain committed through our shared value insurance model to ensure that our members continue to derive value from the product they have purchased. The COVID cashback benefit for any COVID hospitalization has had a significant uptake from our members, especially during this latter surge, and our members have found this financial support to be invaluable. The largest unknown claims fund risk is what the new normal will bring, and compounded by lengthy NHS waiting times, will this drive a greater proportion of our PMI members from treatments that were historically administered in the NHS all into private healthcare? And what will this impact be to premium pricing? We remain at the forefront of digital healthcare and have been working closely with providers to ensure that the early traction into using virtual consultations is maintained, to ensure that providers do not default to behaviors of old. Our digital partner, Senti, now accounts for more than 50% of all physiotherapy appointments, and these start as virtual appointments. 75% progress to face-to-face. However, 25% are guided into self-management. And these cases derive NPS scores of greater than 60, and 93% of our members have experienced a positive clinical outcome. My Online Therapy, our digital mental health partner, was launched in October 2020, and now accounts for more than 25% of all referrals, and is delivering a superior digital journey with high satisfaction scores. We did in August 2020 make a decision to move to a new virtual GP service, effective in December. And this was largely driven from my ambition to innovate in the space and take quality of experience and outcomes to the next level. It has not been without its challenges, but I remain confident that Livy are best suited to achieve our ambition and to continue to lead in digital healthcare delivery. We are now tracking to 30% higher demand when compared to January 2020, and this has largely been driven by the ease of the process and, when appropriate, the onward referral experience. We have been messaging the importance of physical activity on health and risk for nearly 3 decades. One can see from the slides that the impact that physical activity has on hospitalization and mortality cannot be understated. Our members, both in the UK and South Africa's clinical experience with COVID, has enabled us to create the COVID Resilience Index, which indicates that activity engagement does drive improved outcomes and risks from COVID. For example, a 60-year-old with no diabetes and hypertension who does less than 1 activity per week has a 301% greater mortality risk index than a comparable 40-year-old. But when active, more than 2 exercises per week, this reduces to 125%. A 60-year-old with hypertension and diabetes who exercises twice a week can halve their risk when compared to an equivalent 60-year-old who does less than 1 physical activity. A 40-year-old without hypertension and diabetes, however, but has logged more than 2 physical activities per week, has a 45% lower mortality risk than a comparable 40-year-old. And those are impressive results. I thank you, and I'd now like to pass you on and welcome Emil Stipp, our Chief Actuary of Discovery and Vitality.
Thank you, Keith, and good morning, everybody. So we have spent the last year modeling COVID, both what is happening and what is, and trying to get a forward view of what will happen. And what you see on your screen there is a bit of a comparison between the UK and South Africa and the 2 different waves that we had in both countries. As you will see on the right-hand side of your screen, COVID certainly had a material impact on our companies, the people that we insure, and on our communities. But I think if you just look at the graph on the left-hand side showing you the UK experience, it's very interesting that you'll see there a kink in the curve in the second wave, roughly in the beginning of December. And what is quite interesting is when we look at that, we can see that basically the reason for it is that at that point in the epidemic, what happened is that the new variant emerged in the UK. So by roughly the first week of December, it became the dominant variant. And because it was more contagious, what that implied is that effectively there are more people getting infected at a faster rate. And as a result of that, the UK experienced a pretty severe second wave nationally. So what you'll see there is the graph on the left-hand side giving you an indication of infections and deaths. And you can see also at the bottom of the middle graph that effectively we had many more patients hospitalized and many more deaths nationally. What is quite interesting is that when we look at our own experience, So the graph on the right-hand side gives you an indication of the Vitality life mortality experience that we had. And you can see there that the first wave actually hit our policyholders much harder. And it's very difficult to say the exact reasons for this, but I think one of the main things is that the first wave really affected people of a higher socioeconomic status because it was seeded by people going on holiday. But by the second wave, effectively, people of a high socioeconomic status were able to work from home and to self-isolate. And for that reasons, we saw that whilst the national epidemic was very severe, in fact, the epidemic within our own policyholder group was slightly lower. But I think the other thing that might be interesting to you, and looking at it from the UK perspective, is some of the data that we have in South Africa is actually far more complete. Because we are in a position to know what's happening with testing, and because we know who tested positive in our health insurance book in South Africa, we also have a good idea of who tested positive twice. So roughly in January, there was a lot of concern about people having the first version of the virus and then getting reinfected with the second version of the virus. And what you will see there on the left-hand side is some quotes from the media at the time, quoting people, including National Health Authority Service, saying that half the people who tested showed that all of the neutralizing activity was lost from the first infection, that the antibodies was about a third less. So what we did in our own data is to look at how many people did actually test positive twice in South Africa. And you can see the results there on the right-hand side. So in the first wave, in our insured population in South Africa, we had about 90,000 positive confirmed tests for the first wave of COVID. And if we make an assumption that about a third of those are vulnerable to reinfection, roughly about 90 days after recovery, that would mean that there's about 29,000 or just short of 30,000 people vulnerable to reinfection. However, what's important is that the fact that you're vulnerable to reinfection doesn't mean that you will get reinfected. So we tested the people who tested positive in the second wave and saw that actually there was only 674 people getting reinfected. Your personal vulnerability, what the data indicates, is about 28%, but your chances of coming into contact with the virus is much lower at 2.7%. And the bottom line of that is that actually it's important to think about immunity, which is influenced by how many people have been infected, reinfection rates and vaccines, but then behavior remains important, your probability of coming into contact with the virus, and as well the risk. So the extent to which you are protected by having a healthy lifestyle will play a role in avoiding infection. So I hope that was interesting. I'd like to hand over now to Pippa Andrews, the Director of Corporate.
Thank you, Emil. That was some powerful information and insight. Welcome, everybody. And now for something completely different. As you know, here at Vitality, we are committed to making people healthier and supporting their well-being. And today I'm excited to share with you how we're going to go even further and broaden our support to members into an area that's not often discussed. The menopause can have a profound impact on an individual, their family, and their working life. And I'm delighted to share that Vitality is the first UK insurer to offer specialist menopause support through PEPI. PEPI is a digital health solution that connects members to real-life menopause practitioners and wider support through their app. With PEPI, members are able to access physical, mental, and emotional support, and PEPI allows members to take control of their menopause journey. It's integrated with our PMI journeys where it's relevant to do so. So why have we introduced this support? Members and our clients have been asking for our support for menopause for some time, and we know there is a genuine need. Menopause is a natural life transition for all women. That is roughly half the population. But at some point, menopause will impact everyone, their partners, their children, their colleagues, their line managers, and the business overall. The NHS supports provision of medications such as HRT, but far more support is needed. Over 60% of women who go through the menopause will experience symptoms at some stage, and 25% will suffer severe symptoms that require adjustments to their work and home life. Whilst the average age of menopause is 51, symptoms, and there's quite a long list of them, actually start in the years leading up to the menopause itself, and this is called the perimenopause. The average length of duration for symptoms is 4.5 years, and even 7 years is deemed completely normal. So why is it important to you? Women over the age of 50 are the fastest demographic in the UK workforce, and many will look to their employer and their line managers to signpost what support and help is available to them. Menopause support is highly relevant for the growing number of female entrepreneurs who may now, more than ever before, be looking to obtain PMI cover. For you, this is an opportunity to talk to your clients about something different and add even more value, making you, the HR team or the business owner, a hero to many. If you're not talking women's health, someone else will be. So what does PEPI menopause support include? Human accessible support at the touch of a button. PEPI connects members, not just women, to highly qualified menopause practitioners, not chatbots or AI. There ranges from one-to-one instant messaging support to in-depth video or phone consultations, and you can even get a report to share with your GP. This support offers symptom management, treatment referral, and we also offer live events to go alongside this. PEPI offers peer-to-peer support through small group chat, and you can use a confidential anonymized name. And this is all moderated from a qualified practitioner. Vetted links and resources are also available to members, so no more nightmarish Google searches. We've road tested this here at Vitality, and it's proven to be life-saving and life-changing. So please talk to your clients about this. It's a significant enhancement to cover when your clients need it most. I would now like to hand over to the one and only Athos Rushowitz.
Good morning, everybody, and thank you, Pippa. I have the great honor of being able to talk to you today about a subject that's very close to my heart, that of mental health. Now, whilst mental health has always been in our consciousness, the pandemic has certainly driven it up in our awareness. Never before have we been so aware of mental health and the impact thereof. Before the pandemic, we know that 1 in 4 people would suffer some kind of mental health incident in any given year. That is a scary stat. 25% of all of our population will have some kind of mental health issue. The pandemic has accelerated this, and we know that the impact of loneliness and isolation, let alone the additional stresses and anxiety about job security and financial impacts, have certainly made this thing even worse than it was before. Mind have actually called this a mental health emergency, and I think they're right. If you look to the left of the slide, you'll see the increase in incidence rates of risk across the various population cohorts. The scary thing is, at the very top, young people have been more susceptible to increased risk than any other. To me, that says that we need to be so mindful of what we do around mental health, and we have to have a holistic approach to how we tackle mental health and provide benefits to our members. At Vitality, we believe we're in a unique position to make people healthier and enhance and protect their lives, as is our core purpose, but also to protect their mental health. We think that if you start at the very bottom of this triangle and you provide benefits and incentives to be healthier, you can prevent an escalation in mental health issues. We know that there's a direct correlation between physical health and mental health. And we know there's a significant impact in even small amounts of moderate exercise on mental health. And so through our Vitality program, and through ensuring that we're highlighting risks, providing tools, providing incentives and rewards for people being more physically active, eating a better diet, and engaging in mindfulness, we're able to prevent an escalation that oughtn't to have been there in the first instance. However, if there is an escalation, we're able to provide benefits across the spectrum through Vitality Healthy Mind, through Together All, through talking therapy, CBT, and all the way up to the top end of the pyramid, where we're able to provide inpatient benefits too. We also know that only 4% of all of our members will ever need inpatient therapy. And it's therefore so important that we provide all of the ranges of benefits that we do. We're particularly proud of these capabilities, and we want to make sure that our members are aware of their existence. We've seen a tremendous take-up of some new digital assets like My Online Therapy. We're a recent addition to our digital estate, but it's been tremendously well accepted. And I'd like to take the opportunity to hand over to Nick Reed, the Managing Director of our Vitality Program. Thank you for listening to me, and over to you, Nick.
Thanks, Athos. When the first lockdown hit, the primary objective for the Vitality Program was to ensure that it had relevance, and also to ensure that members could still be physically active at home, get recognised for their healthy activity, and be rewarded accordingly with rewards that were accessible and valuable. Within 2 weeks, we launched our Vitality at Home proposition. This involved the creation of new partnerships and benefits, as well as changing the way we traditionally operated with many of our partners. It was in essence a complete recalibration of our program, given many of our partners were sadly closed. And for many others, we had to pivot to ensure that our proposition remained true to our shared value model. In terms of the reward partners that we introduced, we created a coffee at home benefit with our new active rewards partner, Cafe Nero, where we had to create a new benefit and home delivery model to bring coffee to our members' doors if they earned them. Also, given cinemas were closed, we brought video and film content to our members' homes through partnering with Rakuten TV, where members could get weekly movies brought to them by Vitality in their own space to their homes. Clearly, being able to be physically active was of paramount importance to our members, so we introduced a number of activity enablers here. A new partnership with Peloton, where members could enjoy classes online through their app for free, like running, cycling, yoga, meditation, walking, etc. We deepened our partnership with our fantastic ambassador, Jess Ennis-Hill, where we provided free access to her app. And we also enhanced our discounts with our leading wearable tech partners, Garmin and Polar, to 50%, and also reintroduced the Apple Watch benefit for our Life members, where both Life and Health members could enjoy the new Series 6 for a deposit as low as £37, and for the SE for only £17. In addition to these physically active enhancements, we also recognise the increasing importance of providing members with access to mental health support. So we partnered with the global leader in this category, Headspace, again offering their app services for free to our members. Furthermore, we also needed to ensure that members are on top of their numbers and their basic biometrics. And we pivoted our Vitality Health Check service to be digital, where we sent packs to members who requested a health check appointment using a Zoom interface between the member and our Vitality clinicians to check their basic biometrics such as blood glucose, blood cholesterol, BMI, again, all at no cost. And we further invested in this clinicians team to introduce our Wellness at Home services, where we created a calendar of daily classes for all our members to dial into, such as mindfulness or meditation sessions, live home workouts, HIIT classes, nutrition classes. We introduced Coaches Corner, where members could ask Vitality coaches and experts wellness-related questions on a one-to-one basis. And finally, we leveraged our incredible ambassadors to bring virtually themselves into our members' homes by again offering classes and content ranging from a cooking class with Maro Itoji or Seb Coe or Tracy Neville, a Peloton class with Joe Root, a Pilates class with Josh Butler and his wife Louise, or a mental health class with Johnny Wilkinson, by way of a few examples. So how was this received by our members? Well, they truly embraced it. Despite the inevitable dip in physical activity levels upon the first lockdown announcement, we supported our members to get these levels back to pre-COVID levels. Indeed, our most engaged members were even more engaged as they found their new norm. And some highlights included over 100,000 members registering with Cafe Nero, and we awarded close to 500,000 vouchers. We have just under 90,000 members registered with Rakuten, and we've issued over 2.5 million codes. We conducted nearly 30,000 VitalityHealth checks virtually. We have around 40,000 members who are using our free fitness apps. We doubled the uptake in members purchasing a wearable through this period. And finally, the rate at which our members have taken up our mental health support has increased tenfold. So in short, we are thrilled that through this recalibration of the Vitality program with our Vitality at Home offering during this period, our members have been on this journey with us, with exceptional engagement and reward redemption. And our shared value model has never been so alive and so relevant. We also launched the Vitality Speaker Series, intended to keep our minds active through rich debate and discussion with leaders across a variety of fields, from politics to sport to entertainment and to the environment. And we had 40 unique speakers, including Ben Fogle, our founder, Adrian Gore, Sally Osman, who's the former director of comms for the Queen and the BBC. And in politics, we brought Lord William Hague, the former Foreign Secretary, Amber Rudd, the former Home Secretary, and from sport, the likes of David Mahoney, the COO for the ECB, Lord Coe, President of World Athletics and a member of our board. And from the medical profession, we introduced individuals such as Professor Gordon Wishart, the CMO at Check for Cancer, Dr. Cliff Bucknell, the CMO at HCA, Dr. Mark Westwood, consultant cardiologist at the London Bridge Hospital. And we even had an astronaut, Captain Scott Kelly. Another unfortunate consequence of the COVID period has, of course, been an inability for members to enjoy our sponsorships, with all our sports having closed down for the period. That certainly didn't stop, however, our continued investment in sport, particularly our focus on women in sport, with some exciting announcements with new Premiership football clubs, title sponsorship of England in GB hockey, and the introduction of the Vitality Women's FA Cup, to name but a few. Of course, some sports did begin to open up again, but given we weren't able to go to the games to enjoy that match experience, we introduced the virtual match day series. And I'm now going to bring this to life with a short video and then hand back to Greg to continue the session.
Hi everyone, it's Mason Mount here. Welcome to Vitality's virtual pre-match series. It's great to see people joining from all around the world. We really do appreciate all your support.
Whichever team you are supporting, please stay safe, enjoy the game, and on behalf of Vitality, thank you very much for joining us.
Hello everyone and welcome to the first ever Vitality Six Nations pre-match series.
Thank you, Nick, for a truly comprehensive update. Now let's move on to service, the service we provide to you, the service we provide to our members. And we are really proud of what we've achieved in what is a very challenging time. We've had absolutely no break in service provision across all our areas, supporting our members and our brokers. We've also quickly adapted to the changing landscape throughout this pandemic. Like you, like all businesses, we've redeployed our entire workforce to home working. But importantly, we also built in additional member-centric services to proactively reach out to customers we knew were at risk or were vulnerable. We actually launched a concierge function within our claims team to ensure we could support members into care if they had any challenges in accessing care. And we've also adapted our product offering and support to make sure we can be there for our members. It has not been plain sailing, but we've rallied together as a team to deal with these challenges. Do we expect some of these challenges in the future? Absolutely, because nobody really knows what the demand pattern will look like as we move into the coming months. We truly don't know how quickly care demands will surface. But importantly, as a business, we are modeling various scenarios and will be agile and do what's necessary to support our members, your customers. At the same time, our broker servicing model continues to deliver high standards of service throughout the pandemic. We've kept pace in delivering enhancements to our advisor hub, putting more and more self-service into your hands for your clients. Many of you, and I thank you for this, have validated this with me personally. And I've shared this positive feedback with our internal teams. So thank you very much. I always use the phrase, we will never go back to normal, but we're rather going to go forward to normal. Things will go back, but not in the same way. The new working from home is going to remain in some form beyond COVID. And our focus is now on ensuring we identify areas that need further investment so as to support this new trend. One such way is our new BHC Quote and Apply tool, which we've just launched. If you remember, we recently launched a simple, easy and intuitive way to quote and apply for individual business. We can now proudly say we've done the same for business healthcare. Sharing this with you is Carl Houston.
Thank you, Greg. Many advisors tell us that obtaining quotations for group PMI schemes can be quite time-consuming, and therefore I'm really pleased to announce our Business Healthcare Quote and Apply tool. This is designed to be simple and intuitive to make it easy for you to recommend Vitality Health. Let me show you some of the key highlights. So firstly, you'll be able to obtain a quotation for a new customer with 2 to 9 employees. Alternatively, if you've had that quotation produced for you by the quotes team, you can use our handy import feature. That will allow you to import a quotation for 2 to 9 employees. You'll be able to amend the quote and do an application. For 10 plus, you'll be able to do an application. Now, you've heard a lot today from my colleagues about the power of Vitality and wanted to make it easy for you to be able to introduce that into your conversations. And therefore, we've introduced a handy map. This will show where the employer is located and where the Vitality partners are located near them. Equally, you can change the postcode to show a particular employee. Alternatively, you can show the hospitals if that is something that is of interest to you. So as I said, the quotations are very, very simple and very easy. And what you'll notice is that as you make changes, they change on screen in real time. So here I've added full diagnostics, and you can see immediately the price changes. I'm now going to add on mental health cover, and again, that price immediately changes. It allows you to build a plan that meets their needs and meets their budget as well. Once you've decided the variations that you like, you can then save those quotations. And now you can use our handy compare feature. What that will allow you to do is compare up to 3 quotations side by side, looking at the benefits and looking at the price for each of those options. You can then download that as one PDF or download them individually, whichever you prefer. Once you've done that, you'll be able to also look at our Switch and Save campaign. So for customers that are switching to Vitality, we'll give you our standard switch price as well as our Switch and Save price. So you'll be able to very quickly work out which offers the most value for your customer. But of course, once you've done that, the next thing you're going to want to do is apply for cover. And we've made that easy as well. There's 4 simple steps that you need to go through, which you can do very, very quickly, most of which is actually completed from the quotation. So the keying that's required of you is kept to an absolute minimum. Once you've done that, you'll click on a verification link, which will send that to your group secretary. They will check, verify, complete, and that is sent to our new business for priority processing. And as a thank you for using the new system, we have a £50 voucher available for the first case that you process between the 1st of March and the 30th of June. T's and C's apply, and those details will follow shortly. But of course, just making it easy to quote is only half the story. We also need to make it easy for you to learn about Vitality. And that's why we've introduced the Vitality Academy. The Vitality Academy was introduced around about a year ago. And at that stage, we tried to understand some of the barriers to learning. Now, you told us that you want to learn at a time that suits you and at a pace that suits you. Some people prefer to learn in 20-minute slots. Some people prefer to block out an hour and attend a webinar. Equally, we have to keep you interested. Death by PowerPoint is of no interest to anyone. We want to be able to locate information that you find interesting, find it quickly, and tell you the next things that you can do. And that's why we introduced the Academy. It's convenient. You can play it on any device you like. You can play it 24/7. It's efficient. That means that you can absorb information as quickly as possible, but equally you can locate information that you want to go back to really, really quickly. It's also relevant. There's no point learning for learning's sake. So we've made sure the learning is there for the things that you want to learn about. And ultimately, the best learning is always enjoyable. And we challenged ourselves to make this training courses really, really enjoyable. So now let's do a typical Vitality segue and hand over to a video.
Vitality Academy is built around you, making it more convenient than ever to learn and stay up to date with Vitality products and industry knowledge. In a fast-evolving market, we know how valuable a resource time can be, and the vast world of knowledge that you need to navigate to give your clients the best advice. Vitality Academy is a digital learning solution that offers intuitive navigation and the flexibility to choose the content most relevant to you. The Academy structure makes it easy to dip in and out, always picking up where you left off, including easy access through your mobile device. New content is added on a regular basis across Vitality Life, Health and Invest. Whether it's building your foundational knowledge or hearing our key leaders and innovators guide you through industry trends, Academy content is designed to cater for varying needs and experience. And depending on your stated needs, you can use your learning to claim CPD. Getting started is easy. Simply visit the Vitality Advisor website, create your profile, and start exploring.
So as you can see, the content is really engaging. There'll be something there for everyone. You can learn at a time that's suitable for you in a way which I am confident you will find interesting and enjoyable. And you can keep a record of all of your training using the CPD certificates that you can download. Now, if you haven't yet used the Vitality Academy, have your phone ready because it'll have a QR code that you can take a screenshot of and that will take you straight to it. The thing is, we've had already 2,200 advisors and they've taken over 5,000 courses already. So thank you very much for those who've used it. In fact, thank you even more for the fact that you've given us over 60 for our Net Promoter Score, which really makes it a world-class session. We read every single one of the comments and it's really heartwarming to see some of the feedback. Not only does it help us understand how we can make the content more relevant, it means we get new topics for future releases. So thank you for those of you that have used the system. So as I say, if you haven't used the system, please do try. Use the QR code on the screen there and that will take you to it. If you have used it, please keep using it and keep giving us feedback because it is incredibly useful. So thanks again for listening. Let me hand over now to Lara Fassioni, Director of Onboarding and our Retention Team.
Thank you, Carl. Over the last year, as COVID emerged, there was significant anxiety in our retention function about the impact and a fear that our customers would leave the market. Whilst we're not out of the woods yet, the philosophy that underpins Vitality, focusing on health and well-being, has never been more evident. Over this period, we have looked at how we help members concentrate on improving their health and remaining active at a time when the pandemic has made this more difficult. We have achieved this by supporting the journey at key points. This is unique to Vitality and offers something that other providers cannot, and we know this has had a big impact in helping to retain our customers this year. When a customer joins Vitality, they will receive our new welcome emails, followed by a welcome pack, so they have all the key information at their fingertips. But we know that we're different from traditional insurers, and this information can be a lot to take on board. That's why, alongside the onboarding emails, which help signpost the next steps a customer needs to take, we also make a welcome call to every customer
within 30 days of joining to help them register to our customer member zone, to link an activity device and complete the all-important health review, which will highlight any risks that need to be considered. The customer can also access a wide range of online tools, including Employer Hub, Member App, Member Zone, Vitality GP app, our new Care Hub, all alongside our dedicated service and claims teams. In addition, we know that when a journey starts well, sometimes life can take over, and our customers find the earning of points difficult. So over the last year, we introduced our Taste of Vitality program. This actively identifies customers who have not managed to progress upwards from bronze status and incentivizes them to take the first steps using high street and online vouchers to encourage action. Alongside our Vitality magazine and other targeted offers, we have also taken time to redesign our Vitality Reward summary. Recognizing this needed to be simple and clear and really help our customers see the value they earn from Vitality without the need to claim. We also show how easy it can be to move through the statuses to quickly maximize the value available. Alongside changing our reward summary, we have also taken a good look at our renewal invite. We asked our customers what we needed to change, and it was clear we needed to simplify these too. The packs have been completely redesigned to be simple, clear, and easy to understand, and a lot shorter. The emphasis is we don't need the customer or yourselves to take any action unless there is something that needs to be changed. Finally, there's lots more to come. What does engagement and renewal look like in years to come? And how do we make this intuitive to maximize the use of technology? The first step will be to deliver simple interactive video content in the next couple of months, alongside tailored intervention programs bespoke to each customer. To conclude, the pandemic has been devastating in the UK. We have lost lives and we have all learned to live with a new normal. Never before has health insurance been so important, and at Vitality, working with you all, we look forward to truly delivering on our promise to enhance and protect lives. Essentially, we want to keep your customers on our books with our product. Thank you. I'd now like to hand over to Jill Pritchard, Director for Vitality at Work.
Thank you, Lara. With the events of last year, our Vitality at Work programme is perfectly positioned to support organisations help their workforce. Within this session, I'll give insight of the challenges organisations are now facing. I'll give a reminder of the Vitality at Work programme, and I'm also really excited to promote a special offer. Vitality at Work is available for our uninsured population, giving us a fantastic opportunity to expand our influence. Vitality at Work Business is available for our business healthcare clients with 10 or more PMI members. And Vitality at Work Enterprise is for our corporate healthcare clients, but also as a standalone solution for organisations with over 1,000 employees. For today's session, I'm going to focus on Vitality at Work Business, but please have a look on Advisor Hub because there's lots of sales collateral and support tools to help you have those conversations with clients for both. The world of work has undeniably changed as a result of COVID, with many people still working remotely. Most businesses were underprepared for this and now having to drastically review their wellbeing strategy, with many on-site solutions no longer effective and therefore costly. Athos shared this strain of the mental health and the impact that have had on workers, but also we are now much more inactive, losing access to our gyms, but also that passive activity of our daily routine, such as walking to the train station. All of these factors will be having an impact on the productivity of our workforce. Distraction, fatigue, anxiety will all be affecting the performance of our employees, and clients will be looking for opportunities to address this. This is further supported by recent insight from an Aon study, which shows that 75% of employers are now planning on spending more on prevention. 86% employers report that they place a higher priority on communication to their employees. 83% employers want to see apps as part of their wellbeing strategy going forward. and 60% plan to spend more in wellbeing. This gives a fantastic opportunity to expand our influence and help with a total workforce solution. The Vitality Programme is evidence to improve health risk factors across all risk factors. But it's our lower earning employees who are unlikely to have a PMI, but are in the worst state of health. 126% chance more likely to suffer a depression and 64% more likely to spend time off work due to MSK issues. Therefore, to address productivity, we need to support those most at risk and have a solution that supports everybody. The Vitality at Work provides a unique health and engagement proposition to address the challenges of all employees, irrelevant of grade or where they work. Core is the Vitality Programme, as is to all of our services. To support, we have enhanced employee support service to address those key causes of absence. And finally, we provide support to the employer to help them communicate and engage with the employees at a time when they need it most. We then have the opportunity to extend the Vitality Programme to more employees by removing the cost barrier for a PMI to provide an equitable solution for all. We provide further support for those key causes of absence. To support mental health, we have talking therapies with up to 8 sessions of mental health treatment, such as CBT or counselling. We have Priority Physio, providing unlimited treatment in our network of 7,000 physiotherapists across the UK. And at a time when NHS resources are stretched, we can provide unlimited Vitality GP consultations, which also includes the support of £100 to go towards private prescriptions or minor diagnostic tests. It is important that we support the employer to improve that engagement and communications to drive their wellbeing strategy. We have created a free workplace wellbeing survey to help them better understand the challenges that their specific workforce face. And then we have targeted interventions to address those risk factors seen, as well as our support from our workplace wellbeing team with their weekly HIIT classes and workouts at home. So why promote Vitality at Work? Firstly, it'll add value to your clients at a time when wellbeing is a priority. It gives you an opportunity to upsell to those uninsured population, driving greater revenue for your business. Also, it'll give you an opportunity to attract new clients with a new relevant proposition. Thirdly, it is simple. There's no underwriting, no excess payments, no hidden charges. The cost is simply £7.50 per employee per month, which includes IPT. I'm really excited to be announcing a special offer for Vitality at Work for April, May and June inceptions. We're offering 2 months off the total premium discount with PMI and Vitality at Work when sold with a Consultant Select plan and Vitality at Work for the total population, or 1 month discount with all other hospital lists. As well as the benefits to clients, there will also be no reduction on advisor commission. To support these conversations, we're providing a comprehensive toolkit with sales aids, brochures, pitch decks, and also email templates to communicate to your clients. Importantly, we're also offering support for your employers to help them implement an effective wellbeing strategy across their total workforce. We believe this provides a fantastic opportunity to address the challenges employers are now facing with a comprehensive total workforce wellbeing solution, thus expanding our influence. I'd like to pass you over to Greg now, who will close the session.
Thank you, Jill, and thank you all the other speakers for your contribution today. We all feel really strongly about our focus around providing healthcare and support at the moments that matter. And this provides the core foundation around everything that we do. The uniqueness and ongoing innovation around our proposition, digital experience, and journeys will continue to drive us into the future. From our new approach to supporting menopause, to our integrated and truly comprehensive mental well-being offering. We will always drive new thinking and innovation in this healthcare space and have some exciting things to share with you in the future. Vitality as a business has always been built around driving behavior change, changing lives, and improving one's physical, mental, and financial well-being. This core purpose is evident throughout our Vitality program. It's not just a step challenge or a once-off engagement program. It's a lifestyle engagement and change program that drives real long-term sustainable results that we're immensely proud of. It is the essence of what we call shared value. We also know that for us to be successful, we need you to be successful, and hence our ongoing focus to be easy to do business with. That's not just a mantra. It's a philosophy that permeates throughout our business. It's a never-ending learning curve, but a journey we will keep on driving. The new BHC Quote and Apply tool is just another way to demonstrate this commitment, whilst the Academy keeps evolving to meet your training and your learning requirements. And finally, spreading wellness will be a key theme coming out of the pandemic. And making Vitality available to a broader audience will be a business and, importantly, a social imperative. Vitality at Work is a proven, comprehensive wellness program for the uninsured. I can proudly say it makes Vitality accessible for everyone. So in closing today, as a business, as an organization, we're all about innovation. We're all about forward thinking. We have some really exciting things to share with you all, but you're just going to have to wait 2 or 3 months to hear about these things.